Hey, Jim, thank you. Fox 59 is working to answer your questions about the ever-changing pandemic, from vaccines to immunity. We've collected some of your questions that we've received in the past week. And this morning, Dr. Christopher Belcher, Medical Director of Infection Prevention at Ascension St. Vincent, Indianapolis, joins me now to answer some of those questions. Dr. Belcher, good morning to you. We received a lot of questions. Let's start with, what's the benefit of natural immunity from COVID-19, and what is the latest on when natural immunity actually wanes?
Yeah, so natural immunity does happen. It can give you protection or partial protection from catching it again. It is really there. We don't know how long it lasts, but the problem with natural immunity is, to get it, you have to get COVID, and you risk being severely ill or hospitalized or even dying. So it's not a way to go out and get it. Whereas the vaccine has the advantage of being much safer, and you know exactly when you're going to get the vaccine. If you have natural immunity from having COVID, you may spread it to other people. So we don't know how long. We know at least 90 days nobody's going to get reinfected in that short period. That's very rare.
Okay, and if a fully vaccinated person gets a breakthrough case of COVID, how does this affect their status moving forward once they actually have recovered?
Yeah, so it's unfortunate and kind of uncommon, but when people get a case of COVID after being fully vaccinated, it boosts their immunity even further. They're really unlikely to be hospitalized or have severe disease, and it boosts them up. So again, for at least a period of another 90 days or so, many would not recommend getting a booster vaccine at that time.
One viewer asked this question here: do you need a booster if you have had both vaccine doses, which you have to have both vaccine doses to get a booster, and have had symptomatic COVID-19?
Yeah. So again, that waiting period, getting the disease is going to boost your immunity for at least 90 days or so. So it can definitely slow down the rush. It's perfectly acceptable to be boosted after that. It may not be necessary. We're learning more.
How long before we know the effects on fertility in young women?
Yeah, the fertility concern is interesting. There's nothing about this vaccine that makes it seem like it would impair or change fertility, but you can't speed that up to be able to convincingly tell people. So other vaccines that we've seen where people worried about fertility, like the HPV vaccine, has been out since 2007. And it's now been long enough that we've not seen impaired fertility. There's no way to speed that up so much, but so far the registries are not showing it as a signal.
Okay, and we have less than a minute to go here. And the final question we got from a viewer: what about the incidences of myocarditis in young men? We've talked about that in the past, who have gotten the vaccine. Should parents actually be concerned?
I think parents need to be very aware of it. Myocarditis and heart problems do happen when children get COVID at a great frequency. So it is something to look for. With the vaccine, it's a lower risk. You can look for it. And I've taken care of a few of these kids, and they all bounced out of the hospital in a couple days doing well. So again, it's something to be aware of, but not panicked about.
All right, Dr. Christopher Belcher, thank you for your time. Medical Director of Infection Prevention at Ascension St. Vincent, Indianapolis. We'll talk to you soon.
Have a good morning.
You too.